Opioid misuse and opioid addiction are serious problems that plague our society today. The onus is on us as physicians, and particularly surgeons, to manage the use of opioids in our practice and to reduce the amount of opioids that are available for our patients. So as a surgeon, here are 6 things that I'm doing to help manage the use of opioids in my practice and to reduce the amount of opioids that are available for my patients. Number 1, I'm using alternatives whenever and wherever possible. And by alternatives, I mean non-steroidal anti-inflammatories such as naproxen or Celebrex and Tylenol or paracetamol in order for patients to control their pain. Number 2, when I do need to use narcotics, I still use the alternatives, the non-steroidal anti-inflammatories and the Tylenol as baseline medications so that I establish a base level of pain control so that I can use the minimal amount of narcotics that is required to basically shave the peaks off the mountains that are not controlled by the baseline medication. Number 3, when I do prescribe narcotics, I only prescribe a small amount and I don't give automatic refills. So this means that the patient has to be cognizant or aware of how much narcotic they are using because there's not really that much to go around. And then number 2, that there is no automatic refill, so they know that they have to come see me to be reassessed to get another prescription. And it's not just really convenient for them to order more just by calling the pharmacy. Number 4, although I don't really give refills that frequently, if I do give refills, then I always give a smaller amount or a smaller quantity than I gave the last time so that the patient can see that over time they're going to get less and less and that they know eventually they're going to get cut off. Number 5, when I do prescribe narcotics, I try to use narcotics that have decreased central nervous system effects. In other words, they're less likely to make you high. And I try to use narcotics that have less addictive potential. Primary examples include codeine instead of Percocet or hydromorphone instead of morphine. And finally, number 6, physicians who prescribe narcotics can participate in monitoring programs which track our prescription habits so that we can be compared to our peer group and to the populations of physicians as a whole. Also compared to the gold standard so that we know whether we are prescribing more, less than, or the same amount as other physicians. So that's what I'm doing as a physician. How about you? Be sure to let me know.